The Evidence-Based Foundations of Existential Humanistic Therapy is finally out. This is a book that Dr. Veronica and I, along with a number of amazing scholars who have contributed chapters, have been working on for a number of years. We believe this is a really important book for the future of existential therapy for a number of reasons. First, this was written as a political book in many ways. It is commonly misunderstood and incorrectly asserted that there's not an evidence-based foundation to existential humanistic therapy. Well, this is incorrect, and we demonstrate it through this book. First, though, we must critique how evidence-based practice is often misunderstood. No modality is an evidence-based practice. If you go back to the 2006 article in the American Psychologist on evidence-based practice, what it points to is that therapists can practice consistent with evidence-based practice by using a bona fide therapy, drawing upon the best available research, utilizing general competencies in psychotherapy, and adapting for individual and cultural differences. So in this book, we demonstrate how existential humanistic therapists can do that. The second way that this is a political book is through that demonstration. We do have a chapter written by Andrew Bland that looks at the outcome research. We have a chapter by Joe Voss that is looking at competencies through an existential lens, the generalist competencies, and then most of the chapters are taking a process outcome, looking at the components of existential humanistic therapy and demonstrating the research foundations to these and how these different components of existential humanistic therapy can be adapted to individual and cultural differences. So what this book then can do is it can be an important tool. It's not just about learning and understanding the content. Obviously, that's important with any book that's written. But this can also be an important tool in advocating for existential humanistic therapy and its place in graduate programs, in insurance reimbursement, and in agencies. Too often, because of misunderstandings, graduate programs do not teach existential humanistic therapy. Agencies discourage its practice, and insurance companies don't want to reimburse because they believe there's not a foundation to practice is consistent with evidence-based practice. But we have shown in this book that there's research for the components of existential therapy and for the approach overall, that it can be adapted to those individual and cultural differences, and that it can be practiced in accordance with those general competencies. So I hope that you'll get this book and have it on your shelf, in part so that you read it and learn from it, but in part so that you can use this book to advocate for the place of existential humanistic therapy. I hope you enjoy the book.